So, good morning, everyone. Thank you for the Foundation of Hope and Mercy for inviting me on this for this webinar. And first of all, my greetings to all the parents, the teachers of this foundation, and today very important as the Autism Awareness Week. This whole special meaning, this seminar. And today I'm hoping that I'm able to throw light on a better light on how to approach autism and what are the positives and hope as the foundation of hope stands for. What is the hope for autism? And there is a lot of hope. And today, when the parents go back, they go back with a positive intent and a positive ray of positive in their lives. Aside from what is being told all over the world that nothing can be done for these children. So I want to start with positives about what do we know, what are the people we know who had the diagnosis or may not have the diagnosis of autism, but did have symptoms of autism, and what great things they have done in the world. So I will start my presentation. Good morning again. I'm Dr. Nandini Gokulchandran, and I reaching you all the way from Mumbai, India, from NeuroGen Brain and Spine Institute, and welcome to this seminar. The first part of the seminar being presented by me is on recent advances in the medical management of autism. And as I said, important for today's week, the Autism Awareness Week. So this particular talk is only for the purpose of information. It is not a substitute for any medical consultation, and each child is different. Each child is special, and that whatever information I am giving is more a general talk and not specific to any particular child. All that what I'm going to talk is based on scientific evidence which is published in peer-reviewed medical journals. So why are we here? Why are we here today? We are here because either we are caretakers or therapists or teachers or medical fraternity who are treating or managing children on the spectrum, or we are parents, siblings of children with autism or on those who are on the spectrum, and we want to know more about our own children. So my talk is going to be divided into the following four parts. The first, very important, is shifting your mindset, shifting your perception about autism, accepting autism as part of our life, and improving awareness about the potential of our child. And this I want to bring about, especially in Africa, where there are a lot of misconceptions and myths that there could be some devilry or some curse. So I've done a lot of workshops all over Africa, not only in Kenya but other parts of Africa as well. And many therapists and doctors would come up and tell me, please talk to the parents that this is not a devilry, this is not a curse, that this is a neurodevelopmental condition. And so I want you to see what other part of the world, the Western world, how it has approached autism, and what kind of an amazing work these individuals with autism have done. And these are the individuals that and you look and watch them on television every day, and you use the things that they have created every day. So let's have a look at, how do you change our perception and mindset about autism. So first of all, moving from awareness to acceptance and embracing the neurodiversity. It is very important. Don't you think that if all of us are similar and all of us look alike and all of us speak the same thing, it will be so boring, isn't it? So diversity is important, variety is important. So it's important to accept, tolerate, accept, and appreciate those individuals who are different from us. So that healthy understanding is important, and this awareness first has to come into the parents, and then only as parents you can be responsible for spreading it into the community. Most of the time parents feel that, oh, the community should accept us and our children, but unless you accept your children, unless you appreciate your children for what they are and how they are different but as good or better than others, the community will not accept it. So it has to start from you. The change has to start from within. Don't we say charity begins at home? So first you have to change your perception about your children, and then you can defend them and be the voice of your children into the community, and so the community can understand and accept better. The focus now has shifted to understanding rather than the deficits in autism. The focus is about understanding the speciality of the children rather than looking at their inabilities. So we are looking at their abilities rather than looking at their inabilities. And the biggest challenge is that we have to have diagnosis at an early age. The earlier we diagnose, the earlier we accept, the earlier we reconcile that our children are a little different from others, the earlier we can intervene and treat and get them off the spectrum. So these are different. So first awareness, acceptance, appreciation, and then diagnosis. So this shift has to come in us. And let's in this year or in this week or in this month of autism awareness, decide in amongst ourselves that we are going to make this change in ourselves. So let's see what the big people out in the West are saying about this. Because don't we, by default follow what the US is doing, and we look at the US for a lot of guidance. So let's see what has to say about this. And Robert F. Kennedy, who is Secretary of Health, has to say about autism. Let's see about how does Elon Musk and Bill Gates fit into autism. So a few videos here.
Our goal is to get toxins out of our environment, poisons out of our food supply, and keep our children healthy and strong. As an example, not long ago, you can't even believe these numbers, 1 in 10,000 children had autism, 1 in 10,000, and now it's 1 in 36. There's something wrong, 1 in 36, think of that. So we're going to find out what it is.
So why is this important? Did you understand the numbers? In 1975, the number of children or individuals with autism was 1 in 10,000. So we call it very rare, isn't it? And now,
Yeah.
as CDC Atlanta data, it is 1 in 36. That means every classroom having 40 children with autism will have one child with 40 neurotypical children will have one child with autism. And even the president of the United States is now worried. So all of us should have that kind of understanding, or even the medical community sometimes I feel is not so clued in to what's really happening. We worry about the COVID pandemic, but we should be worried about the autism pandemic as well. So this is where even the one of the most powerful men in the US is now thinking about autism very, very seriously. And so now let's look at the health minister equivalent in the US, Robert F. Kennedy, and what is he saying about autism?
If the autism epidemic was an artifact of new or changing diagnostic criteria or better recognition, you would see it in all age groups. In my age group, 69 years old, the autism rates in my age group are 1 in 10,000 still. In my children's age group, it's 1 in 34, 1 in 22 boys.
Isn't that because it comes with a shorter life expectancy?
No, autism does not have a shorter life expectancy. People with autism can live as long as anybody.
So what is Robert F. Kennedy telling? That what many people feel is that because the diagnosis is happening early and more diagnosis is happening, that's why the numbers are looking more. But that is not so. If you look at people who are 70 years old and do a diagnosis of all those individuals, will not see as much autism in them as you see now in a 10-year-old or 15 or 20-year-old. So the autism numbers have definitely increased. And these individuals do not have a shorter lifespan. They live as healthily or as long as any of us can. So it's very important to know why this is, why is this important? Why are we emphasizing on this? Because unless we know the numbers, we will not give importance to this condition. Anything which is rare, we sort of, put it aside, but something which is there in our face and which we are seeing every day and the numbers are increasing, we have to give due importance. Now, but I do not mean to say this coming from a negative perspective. From here, I want you to shift and understand that despite and because of having autism, there are individuals in this humankind who have done amazing work. So that gives us a perspective that our children also can do amazing. They have the potential. We do not have the eyes to see it. So did you know that Bill Gates, though was never diagnosed as autism, having autism, had the features of autism, and he talks about it in his recent interview and book. Did you know about that? Bill Gates, the founder of Microsoft. So if he can, create coding, or he can do the coding,
You've talked
then
about
why
that
not
if
our
you
children?
were a kid today, you would probably have a diagnosis of autism. What makes you think that?
Well, the term, particularly when they say on the spectrum, that's gone from being a very narrow thing to now pretty broad. And I was very slow to develop socially. I kind of rock. I concentrate intensely. My teachers were so confused that in the same grade they said put him ahead 1 or 2 grades, and another teacher said push him back 1 or 2 grades. So that was a dilemma. My energy, my obsessions, fortunately, writing software being one of those, so that worked out well for me. Marked me out as a very different kid in terms of my neurological style.
Your ability to focus as a kid and solve problems in your head, I mean, that you write about, it became kind of a superpower.
Absolutely. I wouldn't trade it despite the other limitations that it came with.
So did you hear that? So Bill Gates
Ladies and
is accepting
Your master
that
plan when
autism and that he would not trade his autism or autistic features for anything in the world, because that gave him the superpower. So start looking at the superpower in your children. Another example I have for you is Elon Musk. Did you know that Elon Musk has autism? He has accepted that he is a high functioning autism or an Asperger's, and
your master plan when you
said this in Saturday Night Live program, which many of us see, don't you? So let's see what he says.
your master plan when you
There is some problem. Okay.
your master plan when you publish that. Meanwhile, I would love to understand more what goes on in this brain of yours, because it is a pretty unique one. I want to play, with your permission, this very funny opening from SNL Master Plan.
So you can see more and more people are coming out there and accepting their autism, embracing their autism, being proud of their autism. So let's stop being defensive about our children with autism, and you will see this superpower, this amazing potential in them. And I want you to start opening up your eyes and looking at this from today on. So let's talk a little bit about autism. What is the autism spectrum? It is a neurodevelopmental condition. It is not a psychiatric condition. It is not a devilry. It is not a curse. Somewhere as the brain is developing, there are certain parts of the brain which are either functioning less, or they do not wire or connect appropriately. And due to some reasons, possibly some hormonal influences, appears to be more in boys than in girls. But of late, we are seeing an increasing frequency of even girls being diagnosed with autism. So it may not be the ratio, though it says 4:1, may not be strictly true anymore. There are changing dynamics here. It's a spectrum, as we said, can be very severe to very mild, and can be Asperger's. And what happens in this? It's a complex neurodevelopmental condition where there are challenges of social interaction, communication, and repetitive behavior. So the numbers, President Trump spoke about these numbers. See, in 1971 is in 10,000, and now in 2020, in 2023, 1 in 36. So autism prevalence has increased by 317% since 2000. Isn't that alarming? So it's so important to know more about this condition. It has surged from 1 in 150 in 2000 to 1 in 36 in 23, and 70 million individuals in the world are affected, 1% of the global population. So now, what is the fundamental problem? Many parents want to know why our child, and what exactly happened, and is it something we did? And so let's try and make some sense of this as easy as simply as possible, let's look at the causes. There are some established causes and there are some controversial causes. So that's how we have differentiated them. The established causes are genetic mutations. 15 to 20% of autism is associated with genetic changes. For example, I say hypertension or diabetes is also associated with genetics. Like if my parents have diabetes, then I'm more prone to have diabetes because of the genetics. So about 15 to 20% of genetic mutations are linked to autism in a direct correlation. The other possible increased causes advanced parental age. If the father or mother are of increased age more than 40, maternal health issue during pregnancy, if the mother health is weak, which I'll talk a little bit more about, and any birth complication during birth if there is lack of oxygen or cord around the neck or seizure or hypoglycemia. So these are established causes. Controversial causes are the vaccines. Of course, many parents and many people keep talking about MMR vaccine, possibly the cause, and there is a regression after the MMR vaccine. I'll talk a little bit about that. Heavy metal exposure during pregnancy, exposure to electromagnetic radiation from cell phones and Wi-Fi. These are controversial because if it is proven, then we can't really stop using a Wi-Fi or a phone, isn't it? So that's why controversial, whether really it will make a difference knowing that this is, and whether we can make lifestyle changes to, prevent that. So let's look at the causes and overlapping. So established causes, genetics, environmental, and most often it is a combination of genetic and environment. Usually not pure genetics or pure environment, many times a combination of both of these. So we have seen twins and triplets having autism, and then in fact sometimes quadruplets also. There are 4 children in a family or 4 children being born together also having autism. Environmental causes, prenatal and antenatal causes, intestinal dysfunction, exposure to chemicals in the environment, and the electromagnetic radiation. What are the prenatal and antenatal causes? If the mother has infection like a torch infection during pregnancy, those organisms or viruses can affect the brain development of the child. Maternal diabetes during pregnancy or depression, mother is on antidepressant, is very, very stressed out. Diabetes during pregnancy, and hypothyroidism, PCOD are some of the causes. Age of the father or mother, especially age of the father, if it is too less or too high, could cause genetic contributions and premature birth and birth complications. So in the age, we see that if a child is born to a father who's 24-year-old or a child born to a father 45-year-old, they are more likely to have autism and 13 times more likely to have ADHD. Younger age children less than 20 years of age of the father also increases the risk of autism, and increased age of the father not only affects his child, but also may affect the grandchild also, so over generations. Heavy metals. Now, many people do a lot of heavy metal chelation in the child now, but what is more important is whether the child was exposed to heavy metals when the child was in the mother's womb. Because now we know that as we are progressing and there's a lot of industry, there's a lot of contamination of lead and mercury in the soil, in the petrol, in the water. So because we're using all of that for a lot of activities, both in agricultural, and there's industry, there is pollution and contamination, all these metals and come into our ecosystem. It comes to our drinking water, it comes into our food, it comes into the fish who when we are polluting the water, the fish also gets contaminated. Many times the fish oil that you give to your child may also be, if it is not pure, come from a contaminated fish. Then even the supplements that you're giving may not be really safe for your child. So all these may finally reach the human body, and when the mother is pregnant, it's very easy for this contaminants or this heavy metal to go into the brain of the child. Why? Because at that time the brain is not so secure. The covering of the brain is still very, very porous, and anything can reach the brain. So virus can reach the brain, and heavy metal can reach the brain, and thereby the development of the brain is affected, and that could be one of the risk factors. electromagnetic spectrum, but can we live without them? Can we live without the phone? Can we live without the Wi-Fi? Can we live without the X-ray? We are exposed to so much of all of this, through our day, and all of this in a pregnant mother again becomes very, very important. That's why now we are advising pregnant mother not to use the phone at near distance. So avoid using the phone when you are pregnant near your tummy, because what happens is that the radio waves enter your tummy and goes directly to the brain, and because the distance is short, it can affect the brain functioning. So if you have to use it, you have to keep the phone aside and use the earphone. So as little as WhatsApp as possible. Watch the bigger screen if you have to watch YouTube. Avoid using phone too much. The Wi-Fi towers have very strong radio waves. So if you are living anywhere near very high Wi-Fi towers, we'll see whether you can avoid going across. But these are again controversial causes, but seem to imply, if you look at the numbers that are increasing, the coincidence of increase in numbers after of Wi-Fi, your Wi-Fi connections, which could be 2G, 3G, 4G, 5G now, started from the 90s and 2000s, isn't it? And the autism numbers have increased, so somewhere it correlates. So this is one few things that we generally recommend, though it is not completely established. Now, about the most controversial topic, that is the vaccines. Now, vaccines, to start off with, I would be very upfront, and as a part of the medical community, which especially in India and in developing countries, where we have seen eradication of polio, we have seen eradication of smallpox only because of the vaccines. I am not completely in favor of getting rid of vaccines. Vaccines are important, especially when infectious diseases, killer diseases are there and they're killing our children, and we're having long-term complications. We can't completely get rid of vaccines. They are important part of our life. But there was way back in 1980s a paper which said in 1998 that Professor Andrew Wakefield from London published an article saying that the MMR vaccine, or the measles virus in the MMR vaccine, was the cause of autism, because it caused an inflammation in the gut, and thereby the toxins got absorbed and they affected the brain development. However, after that, there were many publications which refuted this claim, or which did not show the same correlation, and hence this paper was retracted due to ethical issues as well as other problems. So that MMR vaccine causes autism is not completely established, though that doubt has now seeped into our brain, and we are not able to let go of it. So there are 25 articles studying correlation between autism and MMR, and does not show that autism.
There have been, as I understand it, dozens of studies.
Therefore, in fact, this topic has resurfaced in the U.S. Senate, where Robert F. Kennedy was asked whether he feels that autism is caused by vaccines, and he was not very clear on that. So there is still a lot of back and forth going on it. We believe that vaccines are important, but we all received vaccines in our generation and we do not see so much autism, but we do accept that the number of vaccines have increased exponentially, and maybe too many vaccines are overwhelming the immune system. So it has to be given judiciously with a gap, and only those which are very, very essential to be given, and maybe in later half of the childhood, whenever there is a high risk of autism. So this is about the causes. So if you summarize it, environmental causes could be heavy metal toxicity, medication use in early life, exposure to chemical pollutants and electromagnetic radiation, vaccination. These are environmental factors. Patient and family related, older age of the parents, nutrient deficiency. I will talk a little bit about this. Health status of the mother, genetic factors, and stress in the mother during the pregnancy. Very, very important. So the third part of my talk is what is new in understanding of autism. So we are aware now and we have understood a little bit about the causes, but what do we know more about autism? So what we are going to do is We're going to look at multiple aspects of the same and understand a little more every time we are looking at we are studying it and we are looking at it. We know more and more. In the last 15 years, we have researched and amassed a whole lot of information. So starting with the brain. All of us do accept that brain is the seat of the problem, but for a long time, nobody knew or understood really what is wrong in the brain. And that's where, apart from an MRI, we did a lot of brain scans, and I will be talking about those brain imaging. We'll talk about what's happening in the blood in terms of the micronutrients, genetics, rather more than the cause of the autism, what is really influencing, which genetics is influencing almost every child with autism in terms of the neurotransmitters which are formed in the brain. I'm going to talk a little bit about that, and gut, a very, very important part. Till now, it was thought that the gut is the focus of the problem and the gut affects the brain. So we used to call it the gut-brain axis. But we believe it's the brain-gut axis which first starts, and later on, once the gut is involved, again, the gut affects the brain. So it has now become a vicious cycle. So we start from the brain, we look at the blood, we look at the genetics, and we look at the gut. So we'll look at all of this. We'll do a 360-degree understanding and analysis of autism to understand what is really happening in this child, rather than having a very narrow focus view. So if you remember, I don't know, in our childhood, we used to have this story of an elephant. Did you have this story, Mercy, where an elephant, four blindfolded
Yeah,
men, would look at the elephant, one would catch hold of the leg, one would catch hold of the trunk, one would catch hold of the ear, and one would catch hold of the tail. And the one who would catch hold of the tail would think it's a snake. The one would catch hold of the leg would think it's a pillar. So everywhere, when we look at it in this way, you look at very, very small parts of autism. And I want the blindfolds to be off, and let's look at a child or individual autism as a whole. So that's where today's topic is going to be a little different from the usual seminars that we have had so far. So let's look at the neuroimaging. So look at the brain first. So in the neuroimaging, we have an MRI and we have a PET scan. So I will be talking about both these. What is an MRI? MRI is a structure of the brain. How do I explain this to in lay terms? You are all sitting on a chair, right? And or you are sitting on a chair which has four legs. So if you do an MRI of this chair, you will see whether these legs are intact. So that's what the MRI will show. What does a PET scan give us? The MRI will not tell you how strong these legs are, but the PET scan will tell you how strong are these legs. Is it hollow? If you sit on it, will it take your weight or will it crash? So that's the difference between MRI and PET scan. So MRI tells you the structure or morphology. PET scan tells you about the functioning of the brain. Okay. So the second part I'm going to talk about are the biochemical findings in the blood, the genetic findings, which affect the brain development and functioning, and the gut dysbiosis. So let's look at the neuroimaging. The PET scan. The PET scan tells us about functioning of the brain. And if you look at the brain, this is a brain when you see from the side view. Can you see my cursor? So here the green part is all good functioning brain and the blue part is functioning less. So in a individual with autism, when we do a PET scan, we see different parts of the brain being functioning less. So all these blue areas are working less, and the red part or the yellow or the green part is functioning well. So you can see some part of the brain is really, lighting up strong, and some is very, very dull. The dull part is the one which is functioning low. We call it hypofunctioning, is the one which is the culprit. But the part which is functioning more also contributes, sometimes in a good way and sometimes in not so good way. So we published all of this in the World Journal of Nuclear Medicine in the year 2020, and this is what we summarized. We found that if you look at different ages brain of a child with autism, a child who is 2-year-old, a 4-year-old, a 6-year-old, a 10-year-old, a 14 or 15, initially we find that the brain functioning is quite good, maybe better than neurotypical, but with age, sometimes the brain functioning is going down. So the functioning or metabolism is going down. The structure looks okay, but the functioning is becoming less and less. And so we sort of put this in a graph. If you see this blue graph here, or the blue line, between 0 to 5 years, it is going up. And then between 5 to 10 years, it is further going up, but slowly. This is the brain functioning of a neurotypical child. So in a neurotypical child, it starts from low and the functioning is, or the growth is very fast up till 5 or 10 years, and then it slows down. Now look at the autism brain. It's just a reverse. In the autism brain, initially the brain functioning is high. Many children say, parents say, "Oh, my child was so exceptional. He would he had words and he was so active, and suddenly that he starts regressing." And you see that in the brain too, that the brain functioning is going down and down with age, though slowly. It goes down so slowly that you may not really see a physical change, but you will see a cognitive change in the child. So that's why if you see they cross at a particular time between 2 to 5 years, and that's why we believe that if we can work with a child within 5 years, we can keep this graph up and push it up. So that's why early intervention is very important. The later you wait, you see the gap between the graph. The neurotypical child is going up and up. The autistic child is going down and down, and you see the gap is increasing. So that's why the challenge. Not only because brain is becoming more and more rigid, but also because this brain is becoming much going much further to the neurotypical brain, and that's why it's more difficult to push and get to the neurotypical brain is more challenging at the later age. So that's what the two understanding from the PET scanners, the which areas of the brain are affected, and how much it is affected in terms of severity. This gives us a very good understanding. And we also did a very detailed, in-depth understanding of the MRI. Now, if you look at MRI, when we used to get the report of the MRI would say normal. Everything is okay in the brain, but we did not let it be. So we looked more deeper in. We did a more detailed software analysis, and we found something very different in the development of the brain in a child with autism. So what we have, this you can see, these are two parts of the brain, the pink one, and in between you see this person here who is trying to keep the brain together. So this is basically the corpus callosum. We call it the connection of the brain, the relay center of the brain. So everything the brain cells need to do, they will send out wires and they will connect with each other through this corpus callosum. And so only the brain functioning well is not enough. It has to talk to each other. It has to network with each other. And if this corpus callosum is developing slowly, then the information which has to go from one part of the brain to another, and the information which has to go from up to down is getting affected. So it is found that this bridge between the right and the left brain is overall smaller, and it develops later in children with autism, especially the part which connects in the back. So this is different in children with autism. And once we published it, more of the radiologists, the routine radiologists are observing and finding it. So this is another part. So structure is also somewhat affected, but the functioning is more affected. So this is what is new in autism that we are seeing. So that is about the brain. So that is number one. Now we will look at, so 90-degree covered, the next 90 degrees. So the next 90-degree is the blood findings. What do we find in the blood? Now, the blood has a lot of cells, and blood is also sort of a representative of what's happening in the whole of the body. So we are also looking at what's happening in the cells, whether it be a brain cell or a skin cell, but the blood is the representative. Now, when you look at the cell, every cell has a powerhouse, right? A powerhouse which is generating energy. So you have a DNA which tells you about genetic, but you have a powerhouse which is also the breathing part of the cell, and now this is known as the mitochondria. And many parents can come to us saying, my child has a mitochondrial dysfunction. So mitochondrial dysfunction now is becoming an important part of any disease process, whether be it autism or whether be it aging, or whether it be it diabetes or whether it be it hypertension. And somehow in autism, it is becoming more critical to understand this and try and correct it, because it supports or it prevents the genetic factor from expressing. So only the DNA or mutation in the genes is not enough. The mitochondria also, if it is, functioning less than normal, then the genes will manifest or represent. So what does that mean? That if you don't want the genetics to get, expressed, then you have to make the mitochondria more happier. You have to make the mitochondria more healthier. So that's where the power of the cell, that is the mitochondria, is very important, and it is seen, mitochondrial dysfunction is seen, and we look at it through various factors. Now, we're looking at the nutrients which are important for energy generation finally, because mitochondria is the energy generation house. And when we are looking at these nutrients, these are vitamins we were looking at earlier, but we are adding more and more, and we have seen certain vitamins are very, very important in generating energy for the cell functioning. One of the most important is the folic acid. Now, what is folic acid? For you to understand, it is B9. So we know that vitamin B complex, right? We know B1, B2, B3, B6, B9, B12, right? So B9. So B9 is folic acid. And what we eat, and suppose you're a non-vegetarian, you're eating non-veg food, you get folic acid. Now, this folic acid has to be converted in the body into an active form, which the folic acid is inactive, but it has to be converted into active form known as 5-methylfolate. So you can see here, if folic acid has to be converted to active form. But this process in 80% of children with autism is defective. So the folic acid does not get converted into methylfolate because of a gene mutation. And I will come to that gene mutation later. So if folic acid is there in the blood, it is, even if it's very high level, but it is not activated, it is like a waste. It is not doing anything. And when methylfolate is not formed, then it is affecting the repair of the cell because the energy is not being formed. It is preventing detoxification. That's why so a lot of heavy metals get accumulated. And also the neurotransmitters in the brain, which are responsible for socialization, for speech, for cognition, comprehension, everything gets affected. So this is one of the one of the part of the whole cycle, but a very, very important part, which seems to be very much affected in children with autism. So we have to work at this level. The other things that we see are up and down, which are important in the brain and in blood, are amino acids and neurotransmitters. So what is the study that we see? Glutamate is increased. When glutamate is increased, child shows more anxiety and sensory issues. GABA is reduced. When GABA is reduced, there is poor impulse control and more hyperactivity. When serotonin, what we find, we are doing blood as well as brain. We are looking at the CSF and also in the blood. In the blood, the serotonin is high, while in the brain it is low. That means serotonin is not crossing the blood-brain barrier and going to the brain. It is all right for the gut, but it is not okay in the brain. So serotonin in the brain is very important for mood control, for emotions, and for sleep. Because from serotonin, you get melatonin. Everybody knows melatonin, right? So melatonin is generated from serotonin. And if serotonin in the brain is low, then the child will not have a good sleep rhythm and will have a lot of mood swings. Dopamine is low, which causes less poor focus and repetitive behavior. Norepinephrine low leads to poor attention and low motivation. Oxytocin low leads to poor emotional bonding. So this is an important finding that we have been researching for the last few months, and we have found this. But correction is not easy. Okay, I know that everybody say, oh, this is there, then why can't we correct? We can. But the correction, whatever we give, needs to reach the brain. If it accumulates in the blood, it is of no use. So that is the challenge we are facing now, and we are trying to correct it. Okay, now this was in the blood. Then the third part is the genetics, right? So we have now come 180-degree. Okay, the third part was genetics. So which genetics? So in this genetics, I am not talking about the genetic test that you do to diagnose your child. No, that is not what I'm talking about. I'm talking about genetics, which is affecting the formation of all these neurotransmitters. And that's where this gene mutation of the MTHFR gene is very important. Methylene tetrahydrofolate reductase. So why this is important? Because if there is a mutation in this particular gene and this gene is functioning low, then folic acid will not get converted to its active form. So we have been checking this gene in all the children that we are treating, and we are finding 80%, it's not a small number, 80% of these children have some amount of gene defect. It may be partly or it may be completely. And that's where we are now supplementing with appropriate supplements, that is M-methylfolate and folinic acid. So 80% of individuals have MTHFR gene mutation, thereby they have high level of folic acid, and they have high level of folic acid because it is not utilized, and high level of homocysteine because again, it's a methylation defect. Again, you must be hearing of this methylation. So methylation defect because of the MTHFR gene mutation. And because there is a methylation defect, the homocysteine increases, which needs methyl from 5-methyl tetrahydrofolate. And because homocysteine is high, it can lead to complications. In children, you may not see it, but in adults, if you see young adults having stroke, they have high levels of homocysteine, the blood becomes viscous and causes a stroke. So homocysteine level in the long term, if it remains high, is a problem too. So not only it's affecting the brain functioning, but may also affect the viscosity or the thickness of the blood. Decreased level of vitamin D also is responsible, because vitamin D is also a part of this generation of energy ATP cycle. Decreased oxytocin, as I said, because low level of oxytocin prevents the bonding of the child with the mother, which is very important for emotional empathy. And high level of vitamin B12 level in the mother. If there is high level of B12, again, it means that it is not methylated. So please remember that when you are giving vitamins to your children, you have to be very vigilant, not only to your children, for yourself. You have to look at active forms of vitamins. You can't just give cyanocobalamin, which is again form of B12. You have to give methylcobalamin. So very important. And I'm saying this because I have also started taking methylated vitamins now. It is important for recovery process. So in children also, it becomes very important that you give the active form of vitamins. And that's why without doing the testing, do not give, because you may just give too many vitamins which are inappropriate. So be very careful. Now we have come 180 plus 90, we are at 270, and I'm going to finish the circle. The last 90 is the gut dysbiosis. Understanding the gut is very important, and it is not very difficult. You can do it by just a stool test. Okay, so a stool test gives you a lot of information about what's happening with the gut of your child. So we are looking at gut of our children, and there are a lot of wellness clinics who are looking at the gut of every person who appears to be healthy. Even there, you can get a lot of information, whether this person is prone to diabetes, whether this person is prone to obesity. And in our children, we are looking at, why is gut causing the behavioral issues to some extent? If it's causing any digestive problem like constipation, is there a worm infestation? Is there a fungal overload? All this is very important. Is the vitamin getting absorbed properly? And the gut is another nervous system. It has a lot of nerves in it. So is the serotonin and dopamine being produced appropriately in the gut as well? All this information you can get from the stool test. So 70% of autism individuals have significant gut issues, which leads to behavioral issue, digestive problem, immune dysfunction. A lot of children have low immunity and neurotransmitter imbalance. So also all of this, not only the brain, but gut is also responsible for this. So our own study, we have checked 1,000 stool samples of children with autism, and we have found that there is a bacterial overload in 45% of individuals, bacterial overload of Escherichia coli, E. coli overload, and 59 have Shigella dysentery. Okay, it may not be manifesting, but it is there. And all this causes increased hypersensitivity and repetitive behavior, social communication getting affected. 27% and 11% have fungal overload. 27 have Candida species, 11 have Aspergillus species. So fungal infection in the gut leading to either crying without reason or laughing without reason, jumping and hyperactivity, communication problem, all of this. And 39% have protozoal or a cryptosporidium. Again, it is a type of a worm like an amoeba. So all of these leads to cramps and nausea. And so, sometimes children has colic, cannot tell you. So this is something which we find in so many children. So now we know that all of this is important. So this is the new thing, and this year you're learning all this new in autism, right? So how do we manage? What do we need to do? Is there one pill that can help our children? No. We have looked at the 360, we have looked at 4 parts. So we have to correct all these 4 parts. We have to correct the brain dysfunction, we have to correct the vitamin deficiency, we have to get over the MTHFR gene mutation, jump over it, and we have to correct the gut issue as well. So that's why for a 360-degree problem, a 360-degree solution. So that's what we have come up with, a very integrated, comprehensive care, very, very important. After 15 years of research, and we are, this is something which we are seeing is working beautifully. We have to combine a whole lot of things. We have at the center of all of this is a correction of the brain. The brain is a CPU. If you don't correct it, if you get the best kind of monitor, it's not going to be of any use. So we have to correct the CPU. We have to correct the hardware of the brain. So that's the through the cell therapy. Then assisting the cellular therapy is, of course, the integrative therapy, that is the hyperbaric oxygen therapy and ozone therapy, and of course, correcting the gut and the vitamin nutrients. And to help all of this is the comprehensive rehabilitation. The rehabilitation is an integral part of this whole treatment. Your child will not become all right unless you integrate the rehabilitation with newer techniques. So let's look at one at a time. Let's look at how do we look at the brain, and how do we correct the brain. And despite having corrected the brain for 15 years and having thousands and thousands of brain scans showing that the brain functioning can be repaired, still the question keeps on, or the same old dogma keeps on being repeated, that the central nervous system, once damaged, cannot be repaired. And this is not just 15 years. 15 years back, when I was doing my postdoctoral fellowship in brain development, even at that time, it was shown that brain is capable of regenerating. It is no longer a new concept, but old habits die hard, isn't it? So old thought processes take a lot of time to go away, but it is possible to repair, and I'm going to show you a few examples. So what is regenerative medicine? You call it stem cells, you can call it cellular therapy, we call it cellular therapy. And the tool is a cell, which has this potential to multiply and become any type of the cell of our body. So it's just like a stem of a tree. So these cells are, if you, the analogy, stem of a tree, when you give water, you put fertilizer, gives rise to branches, and the branches give rise to flowers and fruits. But you have to give the growth factor, you have to give the water, you have to give the neurorehabilitation for the stem to properly flourish. So what is this doing? This is a brain. You can, if you remember the PET scan, the blue area is damaged. The cells will go there and they will go to the damaged part of the brain and go and stimulate that part and reduce the damage. So it's suppose you have a fracture of the leg. I'm sure you have either experienced, and somebody in your family has experienced some fracture of a sort, either a leg or a hand, isn't it? So if there is a fracture of the leg, what do? Do you start walking immediately? Your leg is swollen, you don't do an X-ray, you just go, you say, oh, it will heal by itself, I will do physiotherapy. Does it work like that? No. You first go to do an X-ray. You need to know whether it's a simple fracture or it's a complex fracture or is it a hairline. Based on that, you then decide whether your plaster is enough or just a crepe bandage is enough, or you have to really put a screw, isn't it? So if you do this for the leg, why not for the brain, right? Your children have a brain damage, your children have problem in the brain. And unless you fix that problem, unless you repair that hardware, how will the therapy work? Suppose you walk on a fractured leg, what will happen? It will pain more, it will fracture, the fracture will worsen, isn't it? Similarly, think about your children. Your child's brain is incapable of learning or has less capacity to learn, and you're pushing this child to do things that you want him to do. He will rebel, he will throw tantrums. So the first step is always to understand how much the brain functioning is affected, what is the damage in the brain, and to repair it. And once you repair it, then everything else will work. Then all the nutrients will work, all the therapies will work. But unless you repair the CPU of your brain, the computer is not going to function. Okay. So what are we doing here? We are using a modality or a tool which is now like a current iPhone. So if you think about 50, 20 years back, if you had to click a picture, you needed a camera, right? And if you had to listen to music, you needed a tape recorder or a radio. If you need to calculate something, you needed a calculator. If you need to make a phone call, you needed actual phone. If you needed to read a book, you had the hard copy, right? You had to use everything. But now with either iPhone or Android, you can do all of this with one small, rectangular object. Similarly, all that things which were being done by different things and not being very successful, the cellular therapy or the regenerative medicine gives us this tool which has multiple functions, and thereby you do not need medications for every small thing. The cellular therapy will help repair the brain and get rid of a whole lot of the problems that you have been suffering from. So what does it do that we will see? So cellular therapy has a different action. It improves the blood supply in the brain. They multiply and become different types of the cells in the brain. They reduce the cell death in the brain cells, release growth factors, and make new neurons, make new connections. And cellular therapy is not only being used for brain, but also used for many other conditions. So if you look at the data in not on Google, but on PubMed, we call it PubMed, that is the scientific journals, you will find there are publications on cellular therapy, 291 publications, and orthopedics 130, wound healing ischemia 126. So all of these conditions can be treated. And if you look at neurological conditions, 33 in autism, 44 in cerebral palsy, 68 in spinal cord injury, and many more. Even our Bible of medical people, that is the Harrison's textbook of internal medicine, has a chapter on stem cell biology and regenerative medicine. And there are 3 Nobel Prizes given in the last 20, 30 years for the evolution of these stem cells. So 1990 for the demonstration of stem cells in the bone marrow, in 2000 isolation of embryonic stem cell in the mice, and then more recently the induced pluripotent stem cells. So there's a whole lot of scientific. So what is Stephen Hawking saying? Stephen Hawking is saying that your body has all the repair potential. You don't really need to look outside. Your body has this universe of cells, which, if you are able to harness properly, will be able to repair any part of your body. And these cells are known as stem cells. So, how do these cells work? What is the potential of these cells? The main thing is these cells are different from others because one cell here does not only produce one, the one cell produces thousands of cells. That's its main characteristic. Then this cell, if you put it in the liver, they will stimulate the liver cells. If you put it in the heart, they stimulate the heart cells and become heart cells. If you put them in the bone, when the bone is fractured and is not healing, in non-healing bone, the cells, when injected, they'll heal the bone. So they have healing capacity. If you put them in the brain, they can help regenerate the brain. What do they do when they go there? Once they go there, they release growth factors. They release cytokines which reduce the inflammation in the brain. They release growth factors like nerve growth factors or brain-derived neurotrophic factors that stimulate the repair or regeneration of the brain. Then they form new blood vessels. They form new blood vessels and help release oxygen to that part of the brain which is damaged, and they eventually form the neurons in the brain and then the connections. So these are the different actions of the stem cells. Okay, so what do? They form angiogenesis, new blood vessels. They have a paracrine effect, means they release growth factors to stimulate those cells which are functioning less, the blue part in the PET scan. They prevent the cell death. And so that the cell can be healthy, they help in release of neurotransmitters, and thereby we call it synaptic plasticity. Relearning of the cells can happen much easily. They stimulate the cells in the brain, which are stem cells in the brain, to work better, and they reduce the inflammation in the brain. So there are many, many actions. Cells can be taken from our own body or they can be taken from outside. Based on that, you can have embryonic stem cells from embryos, which are currently not to be used because of ethical issues and possibility of tumors. But from our own body, we have adult cells from the bone marrow, from the fat tissue, from the teeth, which can be used without any ethical issues, no chances of forming tumors. But you also have cord blood, which can be used for blood disorders. So at present, we will be talking about bone marrow-derived adult stem cells, because that's what we have been using for 15 years and have a whole lot of experience in that. Because these are 100% safe, they do not form tumors, there are no rejection issues, they are easily obtainable, and no ethical issues. Okay, so how do we administer these cells? We take the cells from the bone marrow in the front using a very thin needle. This is from the hip bone. The cells are separated in the laboratory and then injected in the lower back. You can see a very, very thin needle into the spinal fluid. And these cells then go to the brain and they repair the brain. So this is bone marrow, like thick blood being aspirated in the laboratory, being separated and injected in the lower back. So only 2 injections to the child. So what is published? If you look in the world for autism evidence, the first ever publication came from NeuroGen from India, where you used bone marrow cells. This was in 2013. After that, immediately after that, from China, the third from Italy. US is 4th or 5th in position. Then again 6th from India, that is our publication in 2020. 7th from Vietnam, 8th from Iran, and 9th from US. So these are the scientific publications. What did we show in 2013? In 32 patients that we analyzed, we found that 91% improved. And the second one in 2020, we found out of 254 patients that we analyzed, 95% patients improved. We found that the best results are in those who are less than 5 years of age, almost 98% success rate. Those who are between 5 to 10 years, 95% success rate. Those who are between 10 to 15, 90% success rate. And when we looked at the PET scan, we found that if you see here, the scan before the treatment, the green is all good functioning brain, the blue is functioning low. You can see after 6 months, the blue has become green, right? If you see here in between, the thalamus has become green. So more green after the treatment, green and yellow is good functioning brain. So all the areas which were functioning less are now functioning better. That is the proof. Now, more recently, we analyzed data of 1,011 patients. That's a huge number, right? It is in preprint. It's available on Google. And what did we find in them? That different areas or different symptoms improved. We found 82% of the children improved in attention concentration, 80% in command following, 78% in eye contact, 70% in sitting tolerance, 65% in social interaction, 65% in hyperactivity reduction, 61% improved in communication, 60% improved in speech, 53% in stereotypical behavior, aggressiveness reduced, and self-injurious behavior reduced. We found that the scores also improved in 85% of the children, and there was a significant improvement in all areas of the child's affectation. And when we look at the 1,000 data, we find that 89% of the children, that is almost 90%, show improvement. Those who are less than 5 years and above 15, it is 80%. So as the age increases, the possibility of success reduces a little bit. This is the PET scan to show you before and after. These are various scans. So we have thousands of such scans. And worldwide, if you look again, which I've told you already, 9 publications. The first 2 I have already told you about. Let me run you through what was there in the Chinese paper in 2013. They found that 88% of the children that they have treated improved. They used both umbilical cord cells as well as cord blood mononuclear cells, mesenchymal stem cells. So they used 2 combinations. They used the cord blood cells mainly. Then in the USA, they used the umbilical cord cells given intravenously, and they found that 90% of the children showed improvement after 12 months after the treatment. The next paper from the US again showed 90% of the patients showed significant improvement in their behavior. This Mexico paper looked at the same thing that we do, bone marrow-derived cells, and showed 95% improvement. Vietnam paper showing bone marrow, using bone marrow showed 93% success rate. So bone marrow seems to be having an edge over the cord blood here somehow. So in the Italian paper used fetal stem cells from 8 months old abortus fetuses, and here they showed 78% success rate. So even though its fetal cell seems to be less effective. So these are people looked at different studies together and combined them and looked at. So cell therapy seems to be a feasible and simple option without any long-term complications. And when you combine with neurorehabilitation, what happens? So you have to understand this concept. So in the brain, you have a hardware and a software, right? Like in a computer. So the hardware is treated by the stem cells. So the hardware will be repaired by the stem cells. But if you do not put the software, the computer is not going to work or run, isn't it? When you get a new laptop at home, can you start using it immediately? You need to put the windows, you need to put the apps. Oh, okay, then only it will. So that is done by the rehabilitation, the neurorehabilitation, occupational therapy, speech therapy, the psychological counseling, the special education, and also the home environment and teaching at home. Parents cannot just send the child to school and the therapist and expect everything to happen. Your contribution in parenting is essential. So what is cell therapy doing or stem cell doing? It is improving the hardware. Software that you put in is very, very critical. So speech therapy, psychology, physiotherapy, occupational therapy, aquatic diet, special education, sensory integration, art and music, play therapy, all of this is important. So in comprehensive rehabilitation, you have conventional and you have new. In the conventional, you have your ABA or behavioral therapy or psychological cognitive therapy, you have occupational therapy, your speech, physiotherapy, and special education. In the newer, you have sensory integration therapy and aquatic therapy. Very, very important. We have found has amazing results in children with autism. So ABA helps us understand why is the child behaving like this. If a child is behaving abnormally, you can't just put everything onto autism. You have to understand the antecedent. Where is the trigger? What is the child responding to? Maybe there is a discomfort in the child, and what could be the cause? So that ABC tracking and correction is done by ABA. Then the second is occupational therapy, which teaches a child his occupation. What is the occupation of a child? Occupation of the child is to play. The occupation of the child is to sing. The occupation of the child is to be able to take care of his daily needs, activities of daily living. So all of is done by the occupational therapist. Then speech and language therapy. It's not only about spouting the words, right? Parents want children to speak, but if the child doesn't speak without understanding, what is the meaning of this speech? So comprehension and communication becomes a very important part of speech and language therapy. So it's not just about training the child to repeat the words that you are saying, but also ensuring the child communicates with proper functional language. Then motor impairments. We feel children with autism running around, they have no motor impairments, but if you look at them, they have a problem with their their tone of the body. They do not sit straight. They cannot focus because of that. They have gross motor and fine motor issues. They have a problem in command following and doing multiple tasks like going over the obstacles and climbing stairs. Sometimes they have gravitational insecurity. So all of this can be addressed by the physiotherapy. Art-based therapy. Use art to teach your children. They love to do painting and scribbling and artwork and music. So art-based therapy uses different forms of art to teach the child basic life skills. So this is again integrated. And then sensory integration. Why sensory integration? What does it mean? Very important for you to understand that. So when you look at the brain and you see the central part of the brain, which I showed was thalamus, is functioning less. This part of the brain is important for sensory and motor processing. The small brain in the back, the cerebellum, is important for sensory and motor processing. And when you find that this is impaired, what does it mean? It is not that the child cannot feel. It is not that the child cannot feel the touch. It says that the response is inappropriate. So think about your child. You're talking with each other and the child closes his ears. So what does that mean? That means that even a normal conversation is creating problem for him through his brain. So he is unable to respond to what you are saying. And some children, they like to be touched, they like to be hugged too much. So they are hypersensitive. They like the tactile stimulus. Some children don't like to be touched at all. They are hypersensitive. Some children do not like to brush. They have oromotor sensitivity. So there is sensitivity, either it is low or it is high. So that means there is inappropriate integration of senses, and that needs to be taught. And that's what the sensory integration therapy, by using different techniques, is doing to make the child more adaptive to various senses. Unless a child is able to assimilate the senses, how will the child respond to the outside environment? So it's very, very important that sensory integration happens as a part of initial development of the child. Then only you will get speech, then only you will get comprehension, then only you will get social interaction. So work on the sensory integration as the first step of the child's development. Aquatic therapy. Most children love water. So they don't want to get out of the water. So it's not just swimming, but doing purposeful activities inside water. So improve the posture, reduce the sensory issues, improve coordination, stimulates the speech also. So a lot of things happen when you do therapy in water. So this is about the rehabilitation, and then of course the integrative therapies, which integrate or which push or enhance the results of the cellular therapy along with neurorehabilitation. A few slides about our experience. Yeah. So integrative therapies, I will be talking about hyperbaric oxygen therapy, ozone therapy, gut cleansing, and acupressure and vitamins. So let's look at hyperbaric oxygen. So what is hyperbaric oxygen? Hyper means more, right? Baric means pressure. So administering oxygen under increased pressure. What are you doing now? You are breathing air. You are breathing 20% oxygen in air, but you're breathing it at 1 atmosphere pressure, normal pressure. So 1 is normal. So in a normal pressure, when we are breathing the oxygen, what is happening? Let's see. The upper is a vessel, is a blood vessel. So oxygen, when it goes in through the lungs, where does it go? It goes into your blood. Where does it go into your blood? It goes into the red blood cells of your blood. It gets attached to the hemoglobin. So you can see here, oxygen is going into the red blood cells. This is at normal pressure. So at normal pressure, even if you give 100% oxygen through mask, this is what will happen. So you do not see any oxygen here in the plasma. Only the red blood cells will carry. So there is limited oxygenation at room temperature. So what do we do in hyperbaric? We are increasing the pressure. So we give 100% oxygen, but we increase the pressure of the chamber or the oxygen that you are inhaling, increase it to 1.3, 1.4, 1.5, 1.6, 1.7 above the atmosphere. So now the oxygen is pushed into the blood, and it is pushed into the blood, into the plasma or in the liquid part of the blood. So you can see, can you see the difference? Above, hardly any oxygen, only in the red blood cells. Here, the blood is flooded or flushed with oxygen. So when the blood is flushed with oxygen, what does that mean? Even those places where the blood cells cannot reach, this oxygen can reach because it is in diffused condition. So it can go to very, very, very small parts of your brain. It can go to very, very, very small parts of your skin. It rejuvenates your whole body, but it has to be done in a very supervised and controlled way. Because if you do too much of it, it can affect your lungs and affect your ear. So when we do this, we find that this oxygenation helps the stem cells that have been put in the brain to multiply and survive better, because oxygen is the molecule, isn't it, which keeps us alive. So this oxygenation of our body, which we normally do not get in routine, is helping the stem cells to function better. It stimulates the stem cells in every part of our body, including the brain, to get more stimulated. And then what do we see? Improved, so that is one way of improving oxygenation. The other integrative therapy is ozone therapy. This is another way of improving oxygenation, but by a different mechanism, that is by the way of ozone. So what is ozone? Ozone is O3. Oxygen is O2. So if you see here in oxygen, this one oxygen molecule and this is connected by 2 bonds. It's very strong. Okay, 2 bonds is very strong. But this other one, can you see it? The other one is connected by only one bond. There is only one. Yeah. So that means it is very weak and it is very unstable, but it is an activated oxygen. So 3 molecules of oxygen is an activated oxygen. It improves the gut health. It is a natural anti-inflammatory. It is a natural germicidal. So it can do the work of an antibiotic and an antifungal and an antitubercular, and it can kill organisms which are bad without the chemical that we use in the medicines. It improves the gut health. It helps release of various growth hormones. It has an de-stressing effect. It has an antioxidant effect on the cell. It helps to detoxify because it goes to the liver and it helps to make the liver work better, and helps the detoxification of the heavy metals also. So it has multiple roles, the ozone, and it can be given to children through the ear like this, through a stethoscope, or it can be given through the rectum like an enema. And even the children who are non-verbal, now we have started doing the massage with ozone. Okay, funneling with ozone, which helps the muscles also to become more active. So ozone is being used in autism in different ways. The acupressure, giving pressure points to improve the blood supply and relax the child. So all of this together helps the children improve along with the cell therapy. The other part is, of course, cleansing the gut. So we do the gut microbiome testing using stool, identify the pathogens, do gut cleansing using rectal ozone, restoration of gut balance through dietary recommendation. And this helps to remove all the toxins in the gut or the muck which is accumulated in the gut. It helps to kill the unwanted bacteria and fungi in the gut, improves the absorption of the food and nutrients, and improves the well-being of the mental well-being of the child. Now, in terms of the diet, I will not go too much in detail, but generally recommended is gluten-free and casein-free diet. But in general, follow these few principles. Avoid sugar, avoid additives in the food, try organic food as much as possible, which is pesticide-free. Home food is the best food with a lot of fiber in it. Avoid junk food from outside. Have a more protein-rich food. What can you eat? Food with probiotics and prebiotics. Try natural home food with probiotics and prebiotics. Whatever is locally available. In India, we eat a lot of curd made at home. I don't think in Kenya that is something which, because one of the parent I had to actually teach how to make curd at home. We do that very regularly in India. That is an amazing form of probiotic and is wonderful for gut health. Ketogenic diet, where you have more of fat and less of carbohydrates, gluten-free if possible, then at least avoid the biscuits from outside, avoid the bread, try more of millets, try more of whole grain food, uh, avoid too much of casein, don't make milk the primary food in your child's life, try to reduce it. Camel milk, though, is supposed to be very good. If you get fresh camel milk, do try it. Curcumin, a form of turmeric, is also very good for gut inflammation. And fermented foods are very good. It has probiotics and prebiotics both. Ketogenic is high fat with some protein and low on carbohydrate. And yes, a whole lot of supplementation, but all active supplementation based on blood testing. We do not recommend to give anything blindly because hypervitaminosis is another problem. So all of this needs to be checked and then given. So most important 7 things for the MTHFR mutation, especially those children who have a gene defect: active form of folic acid, methylfolate, active form of B6, active form of B12. I keep on emphasizing on the active form, not just the B6 and B12, the active form. Vitamin D3, the N-acetylcysteine, glutathione, this helps in detox. magnesium in the glycinate form. This helps. All these together will help, especially when if your child has MTHFR mutation, and this helps in the generation of ATP, generation of energy in the mitochondria. So, what are different forms of integrative therapy or oxygen therapy helping in? Ozone helps in enhancing the cellular oxygen utilization, while HBOT improves oxygen in the brain. Ozone helps reduce the inflammation, especially in the gut and the liver, and reduces the oxidative stress. HBOT reduces neuroinflammation in the brain. Ozone helps the efficient working of the mitochondria. HBOT helps production, oxygen utilization. HBOT helps in, ozone helps in enhancing the antioxidants, while HBOT helps in circulation of this blood and toxin clearance. Improves the gut-brain axis. Both of them improve the gut-brain axis. Ozone through the rectal ozone therapy, and HBOT by reducing the leaky gut. It helps the immune system, neuroproduction. In the long term, seizure activity can be reduced, not in the short term. Behavior and cognitive improvement, so and oxidative stress modulation. So a whole lot of effect of the integrative therapy. So when we combine cellular therapy with oxygen-based therapy, what is the different outcome? So we have a group of patients with only cellular therapy and rehab. We have a group with cellular therapy, rehab, and integrative therapy. We found a lot of difference. When you give only cellular therapy, the results is about 87%, but it gets enhanced to 91% when you add hyperbaric oxygen and ozone therapy. Also, we find that the results in terms of outcomes of the different symptoms are better. Socialization, eye contact is better when you add integrative therapy. Aggressiveness reduces. We have seen hyperactivity reduces. So all the areas respond better when you add hyperbaric oxygen and ozone therapy. Even the scores are better, improved almost to a 7 to 8% improvement. And when you look at the PET scan also, we see a better improvement in the PET scan when you do oxygenation with hyperbaric oxygen.
He was screaming, he was crying, I was trying to...
So this is just a few examples before I conclude. So this is a child from the US. The mother will tell her own story.
He was screaming, he was crying, I was trying to hold him, and we were like 45, 50 people on that bus. And so on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic. He can't help it.
He would flap like that. He would walk on his tiptoes, look at the wall and be talking to the wall.
He started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards. We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrible, horrific tantrums. They were decreasing, and when he would have a tantrum, I could talk him out of it. We could engage with him and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it was very exciting.
This is the first time since his stem cell that he has gone to a regular school.
Nash has gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months. When we saw the PET scan images, the areas that were hypoactive or non-active were warm. There was activity there. That moment will always be, a memorable moment.
People say, oh, he's a different child now. He's a lot calmer. He's talking normally. He looks like he's grown up.
He'll say, Mom, I love you. And those words had never been out of his mouth before.
Stem cell therapy offers the potential for a cure. It has been a game changer.
So now Ganesh is 20, 21 years old and going to college. So I think that's an amazing story. I am not going to talk about Mercy. She's an inspiration. I talk in all my talks, but I will leave it to her to tell her own story. um, Let me just give you one more. There are a lot and lot of examples, but let me just no. So this is another child from Kenya. She came to us very young. I'm very proud of this girl, and the mother keeps on updating me about her. She's from Nairobi. She came first in 21. I think she was about 3 years or so at that time, then 22 and 23. She had she had no language. She had comprehension was not age appropriate, low attention span, lot of sensory issues, and over a period of time, her ability to sustain attention improved. She could do fine motor activity, she started doing imitation games and rhymes. Her understanding improved. She became, very sharp in her memories. Her sensory issues started reducing. She started eating new food. She could tolerate loud sound. Her toe walking stopped, tactile sensitivity, fear of height. So speech and language developed. She started playing appropriately. Last time she came, she was being a doctor to her toy girl. She has done beautifully from a cars of 36. She's gone down to 35. Again, much towards the mild to moderate. Her score in terms of the Indian scale for autism assessment went from moderate to very mild. Social age developed from 2 years 7 months to 4 year 10 months. And this is a brain scan. You can see before the treatment the blue areas, and 6 months later the brain functioning is improved drastically. So this is her. Earlier she had no concept of colors, anything. No, her attention improved. She could do all the tasks by herself. Compliance for therapies improved immediately after the cell therapy. Command following earlier, a lot of tantrums. She would not comply at all.
Eat. Okay, what the elephant likes to eat? Eat grasses. Grasses. Okay, what is his favorite? Sugar cane.
This is another child from South Africa. I love his story. When he came to us, he was completely non-verbal, very, very difficult. After a year, he became more settled. Some words started. So before you see the first time when he came, that was at 4 years, then at 5 years. And after this video gets over, I will show you what the mother sent me when he was about 6, 7 years old in 2020. So from a non-verbal child, now this child is completely verbal and makes his own stories, records his own stories, he can create stories on his own. So slowly, so in a year, it's not that the child became absolutely fine, but it took about 3 or 4 years for the child to improve to this level.
Once upon a time,
Same child.
Peter Cat was walking down the street and his friend knew white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love my white shoes.
So this is a 3 minute story. So I'm not be showing you the whole thing.
Pete's
I'll
cat
give you
didn't
a
laugh.
glimpse of what he has achieved. Another example. 11-year-old child. Problem solving. There's a lot of sensory inputs into your hypertonia. So physical input also. So, scientific basis of our work, which I've already said, over 109, 110 publications, and whatever we do, everything is scientifically researched and published. These are all our publications. We have also been invited to write book chapters in various books, such as Recent Advances in Autism, Cerebral Palsy, Physical Disability. A lot of books all available on our website and freely downloadable. We've treated over 15,000 patients from over 103 countries, and these are the two hospitals where we treat all our patients. Complications wise, no major complications of the cell therapy or the integrative therapy. But those who have a history of epilepsy or seizures, there is a 3 to 6% chance of stimulating a seizure after the treatment, but with proper medical cover of medications that can be prevented. 10% of the children do have a headache after the treatment for 2 to 3 days. It is self-limiting and becomes all right with proper hydration, and little pain and vomiting may occur. Our work is all monitored by an institutional review board, which is registered at the government level. So to conclude, for autism, it has to be a multidisciplinary approach of many treatments coming together with cell therapy as the peg around which everything else works. Neuroimaging technique has given a lot of information of what's wrong in the brain. Neurobiochemical investigation has given us a better understanding of the pathways which finally affect the brain functioning in terms of neurotransmitters, and that a comprehensive multidisciplinary treatment or management approach is critical for helping children come off the spectrum. And these treatments, when done together, are safe and effective. To be noted that it is cell therapy on its own is not a cure for autism or cerebral palsy, and it needs comprehensive rehabilitation and medical management and medical along with it to improve the quality of life, and that it cannot be considered a standard of care, but it's a clinical option for ASD. So comprehensive holistic approach would be understanding of the brain using your brain imaging, conventional rehab, special rehab, cellular therapy, oxygen-based integrative therapy, and micronutrient treatment. So all this is what I've covered in my talk, and this is about the government, our Prime Minister supporting the newer advances.
मैं जापान गया
Talking about stem
तो
cells.
जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा।
He's very rarely that politicians talk about, health in parliament, and where he's talking about stem cells in the parliament. That was a big honor for us.
Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research.
So thank you for patient hearing, and I'm happy to answer any questions that you may all have.
Thank you very much, Dr. Nandini, for that wonderful conversation you have given us and opened our eyes. I'm going to open up to parents to ask questions. And if you have a question, you just need to come here because so that you can be able to communicate. Anybody with a question or a comment? Anybody? Yeah, good. So that you don't be left asking me questions. Here is the expert. Come. So what's your question? Okay, Dr. Nandini, we have one parent asking about the cost implication of the stem cell treatment.
So, with due respect, this is I think, academic session, and as a doctor, I would like to focus attention on medical queries regarding the cost. You can get in touch with us. My colleague Sunita will be happy to help you with the cost and logistics implications. So you can leave your contact number with Mercy, and she will ensure that you get your answer.
Okay. Then, pardon? Dr. Nandini, one parent is asking, does this stem cell work for every child?
It depends on the age of the child and whether there are comorbidities. It from our experience, 90% of children it does work, but the amount of improvement would vary depending on the severity of the child, age, and how much therapy or software coding is done after the cell therapy. So there would be certain conditions where the cell therapy is not advisable. When there are severe uncontrolled seizures, it's a relative contraindication. The seizures need to be controlled or somewhat reduced before the cell therapy can be done, even hyperbaric oxygen. Along with that, if there is any viral infection or the child has any blood disorder, then the cell therapy will not work, especially when we are taking the cells from the patient's own body. Any acute infection, any lung infection or kidney disorder, so medical issues need to be ruled out. Broadly speaking, yes, if the child is medically fit, then the cell therapy would help the child to some extent, if not completely.
I have a question.
Yes.
I had her saying that the stem cell, they can rejuvenate the cells to the original function. In my case, my son is nonverbal. Can it really rejuvenate the speaking cells to their normal function? And he has never had any speech.
Dr. Nandini, this parent is asking regarding what you say that the stem cells can rejuvenate the
Cells to the original function.
cells to the original function, and she has her child who is completely nonverbal. How old?
8 years.
Is 8 years old. So she's asking, will this stem cell make the speech cells to be normal and to talk?
So the speech is a very complex function. Speech is not just that one cell gets activated and the child starts speaking. Speech has various components. You have to first receive information. That's the part of comprehension and understanding. Then the child has to be able to process, and then there is a expression, which again connects the brain to the oromotors, and then the speech or words come out. So yes, the cell, theoretically, the cells which are affected and which are important for all these functions will be stimulated by the stem cells. Whether the child speaks or not will also depend on whether you do the training for speaking. So if you look at, we have examples which are real, though we are seeing it in television or in films, that is Tarzan. So Tarzan was, apparently brought up by animals, and he learned the language of the animals. He could not speak the human language. So depending on the programming that is done, yes, your child will be able to speak if you combine the treatment of cellular therapy with training and rehabilitation, and we correct the nutrient supplements. We have seen an 8-year-old, a 10-year-old, a 15-year-old from non-verbal going to verbal. It is possible. But whether a particular child will speak, I cannot say that without, having a look at his brain scan. But it is possible. The possibility, even at 8 years, does exist.
Dr. Nandini, just following up on that, with my son Lenny, who is still nonverbal, but when we were in India, he was diagnosed with another disability of childhood apraxia. Yeah. So I'm just wondering if maybe the 8-year-old could have another diagnosis, a speech disorder that maybe is, yeah.
Yeah, so that's why without completely assessing the child, it's difficult to say whether a particular child will improve. But definitely younger the child, better the possibility. But there are some children. So important is, as much as speech is important is communication. So those who are unable to vocally speak or communicate, we also suggest communication through other ways or devices so that the child is able to function by communication using various tools. So it will depend on a lot of factors, and depending on how severe the autism is, how severe the comprehension is, and even if the words come out, whether it will be functional speech or just words is also important. So yes, I would say nothing is impossible. I am possible in every impossible, but we have to give it a try unless we do. So if your aim is only speech, then sometimes you do get disappointed because there are a lot of other things that is the child independent? Is the child able to do everything by himself? At least take care of his own things. There are children who cannot speak but can read. I have seen that. There are children who are hyperlexic. There are children who can do calculations in the brain. So that's why when I started, I'd say let's look at children in a different way. If we are just clinging to the speech, then you are not, looking at other things which also need to improve for the child to become an independent individual. So let's try to look at things more holistically than just the words coming out.
Yes. And so some communication. Yeah. So, and to get them with supplement for what tends to be one of
Dr. Nandini, this is about supplementation. The parent is asking from what age should they give omega-3 supplementation?
Omega-3, you have to be very careful. Omega-3 is a good supplement, but where do you get the supplement from is also very important. So supplementation can be started at any age, but do not give supplements blindly. Why are you giving the omega-3? Just because somebody has told you to give omega-3? Look at other ways, because there is omega-3, there is fish oil, there are so many things. So you can give the omega-3 depending on what form it is, depending on, so it will be in gel form, and if your child cannot gulp or swallow the omega-3, how will you give it? So if you theoretically you can give it at age of 4 or 5, you can start it, but be very careful when you're giving any supplements. Be sure that the supplement are from a good product. It doesn't contain contaminants. Be very, very vigilant of that. Yes, ma'am.
There's a parent here. I told her to ask because sometimes I lose the question.
Sure, please.
How are you?
I'm good. How are you doing?
I'm good too. We were asking if there's a chance for like 100 parents who can come together and organize, instead of us coming to India with the kids, we organize for you to come to here in our country and do this STEM therapy.
The stem cell therapy requires a lot of organization. It requires a laboratory which takes a couple of millions to set up. It's not like a normal surgery. Plus, it requires a government rules to allow us to do the treatment. Doctors in India have to be allowed to practice there and do the procedure. So it is not a straightforward thing. It's not like giving a tablet of medicine. In fact, I cannot come to Kenya and do consultation. I'm not allowed to do that. You understand? So doing the treatment, even if I want it or you want it, would not be possible. Also, you must understand that it's not just about cell therapy. The whole of my 1.5 hours, that's what I was trying to push forth, that it is a combination of a lot of things. It's not just about one doctor and coming doing the procedure. It has to be about imaging, understanding the child, clinical assessment, doing the treatment, a comprehensive rehabilitation guidance, along with hyperbaric oxygen and nutrients. So it requires a whole team. It's a complete team effort. That's why we are different from anybody else, because it's not just one Dr. Sharma or Dr. Nandini or Dr. Himangi who does the treatment. It is a team thing, and we all need each other to give you the proper guidance. So, I hope sometime in the future we are able to do this, but government regulations do not currently allow us to go there as of now.
Okay, and do we have supplements say for autistic kids?
Yes, it has to be based on the blood workup. You have to look at which levels are low, which levels are, are high. Sometimes there will be high levels. So accordingly, the supplements have to be given.
Dr. Nandini, maybe from what she was asking about parents coming together, what about parents coming together and getting a special package if they come like in a group?
So yes, we do. See, we understand it's not easy one to come and it is expensive. So we do have a group package. Again, my colleague Sunita will be able to help you with that. If you all come together and decide to come. And what I suggest generally is that instead of getting the whole family, one mother comes with a child, and when you come together, you have support of each other. So that also reduces the cost of traveling as well as the cost of the treatment here.
And is it done to kids who have epileptic disorders?
So we are not doing only for epilepsy. We would be treating children with autism who have epilepsy. Yes, we can do the treatment, but the epilepsy needs to be controlled with medications first. So if the child has epilepsy once in a week, once in a month, it's all right to do. But if he has 10, 15, 20 in a day, that first needs to be treated. So the cell therapy will not treat the epilepsy. It will treat the autism.
Okay. Thank you.
Okay. There is, you want to ask a question, right? Okay.
Yes. I heard us saying about embryonic stem cell, embryonic stem cell. Yes. And I heard us saying about human.
Yes.
And the stem cell.
Human,
like the bone marrow.
Yeah.
So now, my concern is,
Yes.
I understand for embryonic stem cell, it's more of like, and there's a plant cell.
Plant cell.
And you know, subliqually. Is it?
I wish you could come here.
Human cell and plant cell, huh? Human cell and plant stem cells. So plant stem cells are more of supplements. They are more of antioxidants.
Pardon my English. Okay, let me just ask you a simple question. Like I heard you speaking about a human-to-human stem cell, that is the bone marrow transplant, and inafanywa na the spinal cord, right? And then we have embryonic stem cell.
Embryonic.
And there is a plant-based stem cell.
I didn't talk about the plant-based stem cells, no. I did not
Stem
talk,
cell.
but I
saw you talking about the tree. I heard you talking about the
The plant-based is no. What I told you was the stem cell is the word stem comes from, that was an example, like a stem of a tree. Just like stem of a tree gives rise to branches, the stem cells multiply and give rise to many cells. So that's it is not plant-based stem cells. That was an example or analogy.
Let me ask you a simple question. Like using my son, right? He's 8 years. He's non-verbal. Right now the tantrums are not high. He walks well. He feeds himself, and he's healthy himself. So now, if I want to plan to come to India, you understand? Maybe I want to involve the community for their support, blah, 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 blah. What kind of therapy and what kind of stem cell am I really targeting to? Is it the embryonic stem cell, human-to-human stem cell? And
Adult
how is
stem
it?
cells. Adult stem cells from the bone marrow.
Okay.
Yes, from the bone marrow. So that, and this will be his own stem cells, nothing from outside. So we take the bone marrow from the child and we separate the cells and inject into the spinal fluid. So the cells reach the brain and they help with the brain functioning. Along with that would be the hyperbaric oxygen therapy, the supplements and all that, along with it, and rehabilitation. So primarily it will be a bone marrow cell from the patient's own body.
Okay, so when you take the stem cell from the bone marrow, it's the work for the brain to detect it can be the cell for every organ which is not functioning well.
No, we will be targeting only the brain. Because the cells will be put only into the spinal fluid. This fluid goes around the brain and spine. So it will either go to the brain or spine wherever there is a damage. It will not go to liver or heart or kidney. No, only to the brain.
Only to the brain.
Yes.
Sawa sawa. Okay, sawa sawa. I now get it.
Anybody else? Any other questions? Well, okay, this may be out of the scope, but she's asking in what stage does one need a donor stem cell?
No, donor stem cells will be is recommended only when your own bone marrow is not functioning properly. For example, if your child has sickle cell anemia or thalassemia, then a donor cell is recommended because your bone marrow is producing defective cells.
I didn't know that. Any other question? Last two questions, if there is. Okay, Dr. Nandini, I think that we are good. Thank you so much for your time. I know you're very busy and we really appreciate. And also on behalf of the parents of this group, I also want to, maybe she can give the thanks. She's the chairperson for you and the Nairobi Early Intervention coming in to sponsor this workshop.
Hello, good afternoon.
We really appreciate for your time. Thank you so much. We've heard a lot, we've learned a lot. Now it's us to digest and then see what next for our parents. So thank you so much and all the best.
What do you say, Asante? Thank you. And I hope this was informative. I know there's a lot, and maybe as Mercy said, we can circulate the video to the parents for them to, listen again to understand, because I had to go a little fast because there was a whole lot of information to be given. So I'm glad it was helpful, and thank you so much for inviting me.
Thank you. Bye.
Have a good day. Bye.
You too.
Okay, bye. You'll send us, Sunita will send us the link.
Yes, sure. Okay.
Thank you.
Bye.
Have a good day. Bye-bye.
You too. Bye.